Time now for News Extra on KNEB and brought to you by First State Bank. And here's Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We're going to talk about Breast Cancer Awareness Month and breast cancer services over at Regional West Medical Center. Today we have Radiologist Dr. Jason Swink and also Lanna Zulkoski, who is the Supervisor for the Breast Health Center over at Regional West Medical Center. So we welcome them. Welcome you guys. First of all, we're going to get right to it. Talk to Dr. Swink simply about the process that the gals are going through to get a mammogram, and there's kind of different steps as we go through. Is that right?
Sure. So a mammogram, as most people know, it's an X-ray of the breasts, and the main purpose is to find breast cancer early. Women come in for a screening mammogram once a year. Those are the current recommendations after age 40. About 10% of those studies will show something abnormal, so they will be called back for a diagnostic mammogram. If something still looks abnormal on the diagnostic mammogram, then we will get an ultrasound and possibly recommend a biopsy. So maybe 1 to 2% of all of the women getting a screening mammogram will get a biopsy. And out of those, maybe a third to a half will actually be a cancer, and then we'll go on to treatment.
Okay, so the percentage is pretty low when you start.
Exactly.
And then it gets maybe a little bit higher as you're going
exactly.
along. Right?
But out of every 1,000 screening mammograms, only 5 are going to actually have a cancer.
All right, so it's pretty low.
It is.
So it's pretty low.
It's a common disease, but every year a small number of women will have a cancer.
And you guys anymore, after you do the screening exam, and then you go through the diagnostic process, does that? I know a lot of women are worried about going in there a number of times to do certain things. You guys have kind of reduced the number of times they go in for all these processes, right?
Absolutely. We try to do things as fast as we can and at the same time if possible. When we do a diagnostic mammogram, we will almost always do the ultrasound the same day if it's necessary. If someone does end up needing a biopsy, we usually do it within, a week? Yeah. We try to really move fast on these things, and then if someone does end up having a cancer, then we can get them treatment really quickly too. So.
Yeah, and the good thing is that we have all the physicians here to take care of the whole situation. Here locally, you don't have to go anywhere to do it.
Absolutely. Every week we'll have patients that want to go to MD Anderson or the Mayo Clinic or Cancer Treatment Centers of America for treatment. And I want to make sure everybody knows that we have really good docs right here in town. We have good oncologists, surgeons, radiation oncologists. We can do the complete treatment right here just as well as they can anywhere else. We have the internet now, so we have all the same information.
So it's pretty neat. How many radiologists are there that say look at?
We have 3 radiologists here in town that read the breast imaging. There's Dr. Johnson, who's been here about 25 years.
Yeah.
And 30 years, and Dr. Chetta, who's been here about 5 or 6 years, and I've been here 1 year, so I'm the new guy.
So you're the new guy. That's why they brought you in.
That's right. That's fresh blood.
That's right, to get everybody kind of used to him. All right, we'll take a break and talk to Lanna right after this.
Hey, Nebraska, Dave Ramsey here. When I get asked where you should keep your money, for me it's a no-brainer. Locally owned community banks like First State Bank in Scottsbluff and Gering. They offer all the bells and whistles of the big banks, but with free checking that includes free e-statements, free online banking, and no-charge First mobile banking, free ATM transactions nationwide, and no monthly maintenance fees. First State Bank, Scottsbluff and Gering. Member FDIC.
Back on News Extra, we're talking about breast health services over at Regional West Medical Center today as part of Breast Cancer Awareness Month. We have radiologist Dr. Jason Swink, who you just heard from during the break, explain kind of how the whole process works when you go in to get a screening mammogram and all the processes that you work through as you go through the diagnosis and so forth. Also, Lanna Zulkoski is here. She is a supervisor of Regional West Breast Cancer Services. So there's various times folks can get an appointment. It's good, first of all, to call to get an appointment, right?
Yes, that's right. We're open Monday through Friday, 7 to 4:30, and we have some extended hours on Wednesdays, the second Wednesday of every month for screening mammograms. And we offer walk-in Wednesdays. You can come anytime and get that from 9 to 3.
All right, a little bit longer wait on Wednesdays.
It could be,
It
depending
could be.
on volume.
Yeah, depending on how many people are in there. So, like we mentioned, it's kind of a one-stop shop for you guys. So you have not only the screening, the diagnostic services, but you also can walk women through the whole situation, right?
Yep. Our goal is to provide the best services for patients for breast health. We have screening, diagnostics. We pretty much do the full service line. We can take care of them from start to finish. We have ultrasound, like we've talked about. We have ultrasound guided biopsies, stereotactic biopsies. We do galactograms, cyst aspirations. We help the surgeons on the day that they go to surgery by placing a wire. And we also have breast MR, and we've just started doing breast MRI guided biopsies, which is a really great service to be able to provide here. We have a patient navigator that when our patients are diagnosed with breast cancer, that person is there personally for the patients to walk them through the whole treatment and just kind of be there by their side to answer questions and provide services. As well, we try to stay up with everything by offering risk assessments. Every single patient that comes through the breast center gets put through our risk assessments, and basically we're trying to inform women and educate women what their options are for surveillance.
Okay. Is this thing, we got about a minute left here. The mental part, is that almost as tough as the physical part?
It is for the patients. That mentally, it's just a lot of anxiety, and we strive to really decrease that anxiety by getting them in quickly, we call them personally so they can ask questions to the technologists and try and decrease that anxiety from the get-go.
All right. Very good. So if somebody wants to get an appointment or talk to you about a screening, what's the number? How do they do it?
They can call 630-2700, option 1. And that is to our scheduling services. And when patients come in and they've had their mammogram, we also give them a card when we're done with our personal number at the breast center. So if they have questions and concerns, they can call us directly.
Okay. Very good. So remember that number is 630-2700, option 1.
Yes.
Right? All right. Very good, you guys. Thank you very much for coming in. Appreciate it.
Thank you.